Attention deficit hyperactivity disorder is the most common mental health illness diagnosed in young children. It is characterized by distinctive behaviors such as hyperactivity, inattentiveness, and impulsivity. The issue is that there are concerns related to the diagnoses, treatment, and actual care of ADHD patients. There is an issue with public and professional concern regarding possible overprescription of ADHD medications. Our first stakeholder is physicians and nurse practitioners. Centers for Disease Control and Prevention reported that since 2003, there has been a 22% increase in the number of children diagnosed with ADHD between the ages of 4 and 17. In 2007, around 4.1 million children were currently diagnosed with ADHD, and of that, 2.7 million were taking ADHD medications. There are no diagnostic tests for diagnosing ADHD. The best way to diagnose ADHD is through the use of standardized questionnaires or rating scales, interviews with parents, the child, and teachers, as well as personal observation. However, most physicians see a child for 5 to 7 minutes, thus leaving it almost impossible for them to observe hyperactivity, distractibility, and/or impulsivity. There is a self-report scale that patients can fill out before meeting with a physician. The best source of observational data is from real-life situations. Professionals must learn from parents, tutors, teachers, activity leaders, and other adults who interact with the child, or adolescents who can describe what he or she is like in structured and unstructured situations. The diagnosis and evaluation of ADHD currently has no reliable objective test, because several of the symptoms overlap with other conditions. Even a skilled clinician can have difficulty in determining differences. Without using proper diagnostic procedures, physicians are frequently prescribing ADHD medications to patients who display symptoms of inattention. In an interview with the New York Times, Dr. Tuckman stated, "It's possible to make a diagnosis by using a rating scale and a 10-minute discussion, but it's far too easy to make an inaccurate diagnosis or miss a diagnosis." Our next stakeholder is pharmaceutical drug companies. Since the 1990s, there has been a 700% increase in medication used to treat ADHD. Pharmaceutical companies have gained a significant influence in the medical professions by using their substantial financial resources. For example, the American Psychiatric Association was receiving more than $13 million annually from drug companies, which accounted for around 30% of their budget. The American Journal of Psychiatry reserves 25% of its pages to drug company-related articles and advertisements that portray medicine as the best treatment. Drug companies have so much power through their marketing, advertising campaigns, and lobbying that they have gained influence over both governments, physicians, nurse practitioners, as well as patient groups. Through marketing campaigns such as direct-to-consumer marketing, drug companies have had a larger influence on the healthcare delivery system. Our next stakeholder is parents. In a consumer survey report, evidence showed that parents were extremely displeased with the medications even though they reported the stimulant drugs to be effective. 44% of parents said they wish there was another way to treat their children for ADHD. These findings have a lot to do with the side effects that the medications produce, which was reported by 84% of the parents. Some of these side effects include a significant increase in insomnia, loss of appetite, headaches, and stomach aches, and even heart problems such as tachycardia and cardiac arrhythmia. Many parents are concerned that doctors are not spending an adequate amount of time adjusting medications to minimize side effects while maintaining effectiveness. They believe that physicians and nurse practitioners are pressured by teachers and social workers to diagnose ADHD and prescribe stimulant drugs to students who display uncontrollable behavior. Rather than just administering ADHD medications to children, there are many alternative solutions that may work in conjunction with stimulant drugs. Our solution is a thorough assessment and evaluation by a mental health clinician as well as multimodal treatment.